Tamatekiman e ngai pero karanga peki mai kake mai ra tēnara tātou kua taimai ki tēnei webinar tuarua o te rau ora. Nā mātou te honore, te rau ora te honore ki te whakatū I tēnei nā. Nā mātou te honore I taimai ngā reo reka, ngā rangatira o tērā o te tai rāwhiti, ana, Francis King. No konei, no te waka tapu o tainui ko te rina moki. Wai mari a hau huki ki te whakahaere ana tēnei webinar, no te mea ko era o tapu whakapapa. Ki te tai rāwhiti, te taha o tōku māma, ana o tiki, ana te taha o tōku pāpā o tainui waka. So we're really privileged today order to have the second webinar underway, and we welcome our two speakers this morning from Whairāwhiti, from Ngāti Prau Hauora, Francis King, who will tell you about herself, and also Terina Moke, the CEO Moke of Raupura Hauora Tai. Nō reira ki a pūru, no mai hara mai, no mai hara. And I'll leave it to Francis to start us off today. Tēnā rāpu.
Tēnā koutou. Ko hikurangi te maunga, ko waiapu te awa, ko Ngāti Prau te iwi. A whānau rua, no Tokomaru Bay ahau, ko Francis King ahau. I'm a manager at Ngāti Prau Hauora. I currently manage our Te Puia Hospital services, maternity, our home-based support services, our mental health services, and our research and our newly established team down in Gisborne, Te Hiringa Matua, which provides service to the whole of Tairāwhiti. I've got a little presentation to take us through. So I'm just going to share the screen. So Ngāti Prau Hauora, our vision is around our next generation living longer than our last. So when we deliver our services, our health services, that's what we're all striving to achieve. We are a primary health organisation in a charitable trust, and we are owned by our iwi, Ngāti Prau iwi. We're the only iwi-owned hospital in New Zealand. Well, I suppose that would make it the world. We deliver services to everyone in our region, irrespective of their ethnicity, and our aim is to improve the health status by increasing our life expectancy. We're one of the smallest PHOs in New Zealand, and we've got just under 10,000 people enrolled. 88% are Māori. Our coverage is quite a large area, from down in Kaiti in the south, Gisborne, down here, right through to up here, Pōtaka, Lawton Point. So we boundary with whānau Apanui. We've got 6 clinics. Our biggest clinic down in Gisborne called Puhi Kaiti, a clinic in Tolaga Bay, Tokomaru Bay, at the hospital, and we've got our Tawhiti clinic, Ruatoria and Matakawa up in Te Araroa. I'll just run through the structure. So we've got a small board. We've got our hospital, which has a mixed medical ward aged care a small A&E X-ray department. We have outpatient clinics and a small 3-bedded maternity. In mental health, we provide services from Anora Bay, which is between Tolaga Bay and Tokomaru Bay in the south, through to Pōtaka, and then we have the newly established Te Hiringa Matua, which is one of the pregnancy and parenting support services. And then we have our community clinics, which I've briefly run through, with our GPs, kaiawhina, practice nurses, rural health nurses, and administration support. We have a home-based support service which works out in the community, our caregivers, our physio, which travels along the coast, and our midwife. And then we have a team called our Ngāti and Healthy team, which delivers mama and PP services, rheumatic fever, healthy homes initiative, those sorts of things, whānau ora. And then we've got our research arm, and we currently have about 6 research studies underway. So my reflections around preparing for COVID, these are the things that I think have helped us to be prepared, to be ready, and to work through. So our preparation started in early February. There were a lot of meetings with all our teams and all our staff, our domestic staff, our kitchen staff, our hospital staff, our clinic staff, our doctors, our nurses, our kaiawhina, trying to get information out to them and meeting to work out what we needed to do to be prepared. We all know that the alert levels changed quite quickly from 2, 3 and 4, so that put everyone under the pump. Being a small organisation, when we were asked to set things up like the community-based assessment centre, that had to be mobilised within 24 hours, and we realised that we're a small organisation with a small number of staff, and we knew we had to get in early to prepare ourselves for what may occur. So in our hospital, we've got the mixed ward, which has our aged care, our paka care, and they were a priority for us to protect. So we had to think about how we were going to continue to deliver medical care and our emergency care should people walk through the door. And what we decided was to split our hospital area off, and we actually repurposed one of our old wards, which normally has the home-based team and the Ngāti and Healthy team, our teams in. We repurposed that for what we called our community-based assessment and treatment centre. So if we had any whānau that were going to be presenting with respiratory illnesses, we actually had them totally in a separate area. The time that it took us to do that was quite incredible. Everyone pitched in to support our maintenance team, our cleaners, just everyone, all our teams pulled together like we've probably never seen them pulled together before. It was incredible. That was in preparation. We thought, we prepared for the worst, even though we didn't want the worst to arrive, and started thinking a bit further beyond. What if people start getting really sick like they had been in Italy? If people started dying at the rates that they were in Italy, how are we going to cope with that? Being quite isolated from Gisborne, we didn't think that the services down in Gisborne were going to be coming up here to pick up our people that had passed. So some of that preparation included things like getting our morgue up and running again, getting our chiller fixed and turned on, just in case we needed to. Once all of that was done, we had services like the police, St. John's ambulance coming through to look at our setup and the doorways that they would use to come in and out of the building, the areas that they would have to have PPE on, that sort of thing. So there was a lot in the setup and the preparation. Then I mentioned about the staff pulling together. So that was really around the attitude and commitment from our staff, who were amazing at the time. We've got about 140, between 140, 150 staff, and we had to know all of our staff, consider their age, their own health status and vulnerability. So anyone who was over the age of 70, who had chronic medical conditions, we had working from home or off work on full pay. Our teams, our caregivers out in the community, we had them all set up with PPE, gloves, hand sanitizers, viral wipes, masks, surgical masks, and did training to all our staff on how to use PPE correctly. We also put together some little wellness packs for our staff that were out in the community. Yeah. Our hospital, we had to really look at the areas in infection control, and we set up extra cleaning trolleys, for example, for the cleaners, so that there were separate areas that they didn't pass from one area to the other. Which takes us on to our learning. So I think our we've put together a list, and some of our learnings are the value and early preparation, good communication and rapid adaptation from our teams, obtaining extra supplies for kitchen, cleaning, PPE, medicines, medical supplies, with the understanding that rural areas are often the hardest hit and the most difficult to get supplies in and out of. So we ran early in trying to get those supplies up. Our kitchen, we had about 3 months supply of food there, little things that we did additional to bringing supplies in was made sure our marakai was pumping, that we had lots of vegetables, preserving kai that was around at the time, and we were lucky over that period because the weather was so kind. Another one of our learnings was acknowledging or knowing the strength of being small and tightly connected, both as an organisation but also to our communities. Having clear decision making and communication again around how we were going to be delivering services, modifying our facilities like I mentioned, mobilising and redeploying staff and resources to areas where there was greater need. So an example of that was our kaiawhina. We've got kaiawhina in each community. We had some of our other community teams work alongside them, and they were going out delivering hygiene packs, kai parcels, all those sorts of things, as well as doing wellness checks on all our pakeke and our vulnerable whānau. Implementing processes and adapting them as we went. Any time that things didn't go quite so well, we'd talk about it. It wasn't around blaming, it was more like, let's use that opportunity to learn and do things differently. So there was quite a bit of that. Leadership's really important in an emergency. Being well informed and being able to make clear decisions, staying connected, in a time appreciating that it was quite stressful with a lot of uncertainty. So being able to reassure staff and having that can-do attitude. I've talked about communication and coordination, probably can't stress that enough. This was critical. So communication internally as an organisation, but also with our whānau, our communities, our runanga, and other community groups that we're also working out in the community for our whānau. Being proactive, that go-getter attitude, not waiting for the government agencies to make decisions or provide solutions for us. We talked about what we needed and we made it happen. And an example of that was around our early orders for our PPE. We were really wrapped with our local school who went about making hand sanitizer for the hauora and face masks and those sorts of things. So the community really got in behind us. Acknowledging that staff and their whānau were affected by the lockdown, and I suppose from us having as management making clear decisions around having arrangements for leave, paying people, ensuring that they are paid if they were unwell or needing to self-isolate, pacing our work so that we didn't all get tired at the beginning of lockdown, and being able to go through as the weeks and months ran by. And recognition of our staff that actually went over and beyond in the usual work to provide additional support. That was really appreciated. Use of technology. So we've not been strong on this in the past, and I think this kind of forced us into things like Zoom huis and virtual consultations and that sort of thing. Everyone came on board very quickly. Mental health was a really big issue, and a lot of impact with additional stress from whānau who had a lack of resources and job losses, unemployment, you know, financial stress, increased isolation. Having active, so despite us having active outreach to our communities and also to our whaiora, we knew that people were struggling at home. So we tried to maintain telephone contact, and anyone that didn't have telephone, we sent somebody out to home visit. So they would go to the gate, talk to them, see if they needed anything, provided what resources we could to families, and we know that the areas that really affected our whānau were things like domestic violence as pressure grew, and addictions, drug and alcohol, as people were not able to access their usual alcohol, drugs, you know, the additional stress came on. I can remember saying the first week of lockdown was quite quiet. The second week there were slight rumblings. By the third week, I think the wheels were starting to fall off, and we were starting to see some of that stress really unfold. Our community safety responses. So you would have seen that we had roadblocks at either end of the coast, which really helped our communities feel supported and safe, reducing the risk of people coming in from out of the area. I think another learning was having visible and functional infrastructure, so that people knew where to go for help when, and instilling hope in a time that was really uncertain. Another one of our learnings was our self-reliance and resilience. We've got the answers, we've got the ability, we've got the capability, and some of those initiatives like our marakai, our preserving, our maintenance team who monitor our water quality, our sewage, those sorts of things, people going the extra mile, you know, during a crisis situation. And then the additional funding, because it all cost, you know, extra. Okay, so if you'd like to read about our story, it's actually published on our website, www.nph.org.nz, or you're welcome to flick me an email, francis.king@nph.org.nz. So, any questions?
Oh, is it a Tino mihi kia koe, Francis. E mei haro ki te rongo, that you're an iwi-owned hospital, that you're tribally based, and you feed and care for our people on the coast. It was one of the dreams that our tupuna from Tainui had, that we would have our own hospital. So I said, well, if it's a Tainui waka, we need to go to Ngāti Pro and see how you did it, because you've been up and running as part of your tino rangatiratanga and your mana motuhaki. Yes, as Francis said, they have documented their journey, and it is part of our publication that's coming out at the end of the webinars, called Tōku Ara Ra COVID-19 Aotearoa 2020. And what I think it shows is clearly a roadmap of how to deal with something, a ngangara that's come into our world and come into our country that could devastate us. And it's a clear roadmap, and it shows of resilience. It absolutely shows of resilience from a rural area, from a remote rural area, on what they did in terms of their internal resilience and the sharing of their resources amongst each other and the caring for each other and the manaaki that they showed towards their communities and their wellness packs, including their schools, and carrying on with not only this extra load, but business as usual, making sure wellness checks were done. I also heard the external support from police ambulance. I'm yet to hear something in regards to Tairāwhiti DHB, which provides funding for that, the whole of that body. And the other one is Civil Defence. And they are funded in this area too. And I know from your own perspective, Francis, that you wanted to get things up and running very quickly. And it has to be like that. We have to respond quickly. And that Māori have shown, and Ngāti Porou you've shown, you've not waited. You've gone out and done it. You've gone out and looked after our people to make sure that they are sheltered. What could be devastating. And what I love about Ngāti Porou is you protected your borders too. And you said, you're not coming in here, you're not coming in here. If you don't whakapapa to us, you're not coming in here. And that is also, that was also a strategy that our Indigenous brothers and sisters need to know. The resilience and the sharing and the manaaki of our own very quickly. Get them up. Don't wait. Don't wait. So thank you for that. And I did ask. So Francis actually's got some vacancies. So all you Ngāti people where you listen to this and say, oh, I want to know what's going back on for my people. Well, you get yourself back home because there's some positions there amongst the hospital and that famous Te Puia Springs Hospital. So get yourselves back and be one of the numbers that count from a fabulous place on the coast. And I acknowledge Tōku Marube, who always look after us when we go over there, and that little dot for Tiviti. So thank you for that, and you have Francis's email, so please do get onto those websites. So our next one, we're coming back home here to Waikato, and I'll pass it across to Terina. Tēnā koe, Terina.
Tēnā koe kahu e te rangatira nau mai, kei te mihi aroha ki a koe e hoa. Kia ora tātou, kia hau nei he mokopono ngā tūpono te tai hauauru me te tai tukurau. Te taho taku pāpā no kāwhia moana, kāwhia kai, kāwhia tangata, te tumu o te waka o tainu. Te taho taku whaia no tinana te waka, ko te rarawa te iwi no puki poto ia. Engari, e tuku ake a hau e roto i te rohe o Ngāti Toa Rangatira I takapua hia ki Pururoa. Nō reira, tēnā tātou katoa. Kia ora tātou, my name is Terina Moke. I'm the CE of Raukura Hauaro o Tainui. I'm just briefly, I wanted to mihi to Francis first off and also the mahi of Ngāti Porou Hauora. In particular, it is heartening to see the similarities between, I think, what a lot of Māori providers did during Alert Level 4 lockdown in terms of standing up, mobilising, being agile to respond to the needs of our people and also to all of the people that live in our tribal boundaries. So big mihi to you, Francis, and Ngāti Porou Hauora. to everybody else, really I'll introduce in terms of who Raukura Hauoro Tainui is. So Raukura Hauoro Tainui we're a charitable trust, but we are really based around the aspirations of Kingi Tāwhiao and actually the Moemoeā of Princess Tupuia, and also the legacy of Te Araiki Nui, Te Atairangi Kāhu. And it is around reclaiming the health and well-being of Tainui people. We are based in Waikato, predominantly around Kirikiriroa, Ngarua, Wahia and Huntly. And then we extend up to the northern tribal boundaries of Waikato into, well, the Pākehā is, well, you know, Counties Manukau DHB region. And we provide services in those regions. We have a staff, I have kaimahi of about 120 to 130. We have 4 GP clinics based here in Waikato, and we have a alcohol and drug treatment residential, a kaupapa Māori treatment residential facility in Wiri, in Manerua. We provide primary health GP services. We also are part of the Waikato Tainui Whānau Ora Collective, alongside 3 other iwi providers of Waikato, Te Hauara or Ngā Ti Haua, Ngā Miro, based at Turanga Waiwai, and Wāhi Whānui, based in Huntly. And then we also have a combination of community service contracts, both clinical and non-clinical, in Waikato. We also deliver a lot of mental health. We're one of the biggest mental health and addiction kaupapa Māori providers in counties. So that's kind of our spread and what we do. In terms of talking around COVID, it is hard. In order to talk around COVID, and because we are Raukura Hauoro Tainui, it would be remiss of me not to mention the influence and the legacy of Princess Tupuia, particularly the way in which she led our people during the 1918 influenza pandemic here in the Waikato. And in fact, you take strength, we all took strength, and confidence and the urge to respond originates from her legacy, really, and also the feeling of being compelled or obligated. It's similar to what Francis talked around when you're working for your people. There's much more at stake. It's more around obligation rather than this is a 9-to-5 job. And also when you talk about that, also then you have to really reflect on the huge Māori health inequities that exist, and that if COVID got into our communities, particularly our rural, our kaumātua and ruruhi communities, we would really, in my view, it would be devastating. So those are the types of motivations that drove Raukura and all of the kaimahi, and actually all of the iwi providers inside Waikato to respond in the way in which we did. So for us, I'm just going to I'll just share the screen. So can you see that? So that essentially was, we recognised that we had to communicate. Well, first we had to look after our kaimahi first. So like Francis, we had a lot of vulnerable staff, and so the first rule was everyone had to work from home, and we had to make sure that our vulnerable staff were well looked after. Or we had kaimahi that had vulnerable whānau members. So that was first and foremost, was to look after our own kaimahi. The second thing was just before Alert Level 4 lockdown, the College of GPs came out with a directive to to direct all GP clinics to shut their doors and to remove and move to virtual consults. So for us as a Māori GP provider, we scrambled in terms of trying to get the IT equipment and get us all up and running to be able to do that function. The other thing to that was, at the time, the mixed messaging going on from the government was saying, you know, we stay at home, and this is an example where we were telling people, you know, just stay at home. But a lot of our patients were interpreting that to mean don't go to the GP. So probably like Francis, we went dead quiet in terms of our GP clinics in the first week, and we had to kind of work really hard to get people to engage in receiving primary health, addressing or receiving primary health care, regardless, while we were in alert level 4. I think one of the things that drove Raukura, and we actually went early, so before the government announced the move into alert level 4 lockdown, Raukura had initiated a call to action to all of the iwi providers in Waikato, and also to the tribe in a sense. And we held a hui out at Hopu Hopu, which is our tribal chambers, where and we had a big kōrero around, as iwi health providers, we needed to mobilise and get and be able to respond to COVID. What as a result of that, the best thing that happened is actually Waikato Tainu, the tribe, stood up and enabled and provided the korowai for all of the hauora providers, Māori providers, to come together and collectivise and coordinate a response. It also included Waikato DHB, counties DHB, and to a certain extent, I can't remember, I'll come back to that. But what we were able to do was start to mobilise very quickly and start to coordinate the mobile services. At the time, there was a real push for flu jabs and prioritising flu jabs. But so that was for Raukura to stand up and help assist in that. But at the same time, we had hardly any PPE gear. There was a real struggle to get PPE gear, and there was the vaccine started to run out. And so we had people, either other GP clinics or pharmacies, start to stockpile vaccines, and we were running out. We were running quite low. So one of the things that has struck me around our response, and actually looking across all the Māori providers and their responses, two things really. One is agility, the ability just to get up, mobilise, collectivise and respond. Also part of that, I really noticed, we start a hui, a zui, and start with plan A. By the end of the zui, we were up to plan maybe D, and by the end of the day, we were up to plan Z. But that was an indication of how fast we could adjust. And that was, and that also speaks to the way in which the providers communicated with each other in real time. I got a real good sense of people put their egos aside, and we just got on with the mahi, because we couldn't do everything everywhere, so we all just divvied up and did what we could. So I really, so that agility was so crucial. So one of the things I wanted to show, and I'll just put it up, is around innovation. So as a response to the lack of PPE gear, it was actually driven by my clinical services manager, Serena Wawatai. We looked overseas. So we looked at the way in which other countries were responding around PPE gear. And Serena actually saw something in South Korea. And I'm just going to flick it up. See if I'll just come off this. I'll stop the share and then I'll flip this up. So you can see this. So we actually saw this in South Korea. And so we got it made up because during Alert Level 4, there were a lot of builders that couldn't do anything. And some of them were essential workers. So we approached a builder and he was able to spec this out for us. So we nicknamed this Roxanne. And basically, it enabled our nurses to go in without any PPE gear on and put their hands through the gloves. And they were able to do flu jabs. And then actually, we used it to do COVID testing. So that was in direct response to we didn't have enough PPE gear. And so I think that's a really good, and it actually, the first time we trialled it was at a wharekura out in Huntly at the Rako Mangamanga, and it was a bit of a hit in terms of, you know, what is it, all of that kind of stuff. So we have taken that around as another way to administer either COVID-19 tests or do flu jabs. So that, you know, it's quite a visual kind of example of just trying to be innovative and responding. I'll just take us off. So for me, it was really around, I was struck by agility and also by innovation. I was also, in terms of how we operated up in Tamaki, we actually set up high distributions teams in both rohe, and they were responding to the communities. We had hygiene packs. Waikato Tainui had assembled kai packs, so we were distributing out as well as assessing needs. One of the other primary health needs we figured out was people were engaging in virtual consults, but then they weren't going to pick their medicines up. So we provided a free service, a daily service, where we would pick up their medicines. We covered some of the initial costs, and then we would deliver it to their door. And we knew, and that was really effective and helpful for us. In terms of other key learnings for us, I think, is be agile, is continually adapt to the way in which things are changing. We never waited for ministry funding. We just moved. And we found that when the funding did follow, it wasn't too late, but it was quite a way down the track. But that didn't stop us from responding. We did have big challenges. I had a workforce that didn't have appropriate equipment to work from home, like laptops, phones. We set up and some people in terms of finance couldn't afford to pay the monthly data, the internet bill. So we provided an allowance and a contribution to that to help our kaimahi. So for us, it was around continually moving, continually adapting, being agile, not necessarily not waiting for the funding to drop or not doing anything until funding dropped. We just kept moving. The other thing we did was we used geospatial mapping to track all of our data. So I don't think I can show you, but what we did is we mapped our flu jab data. We aggregated the information by age range, ethnicity, gender, and where they lived. So we actually could map in terms of coverage. We could map a whole street. We mapped kai packs, pharmacy deliveries, hygiene packs. So the importance of that was, for us, was not necessarily where we had been, but where we hadn't been in terms of identifying parts of, say, a street where we hadn't, and that then meant our kaimahi workforce could then go and target those ones in those houses to make sure that they were okay. I have to say, I noticed during this process is a lot of our tauiwi providers were silent or invisible. I would say our Māori providers, our kaimahi, you could see them everywhere, and they were much more visible in our communities. But for me, it was we've just got to focus on what we are doing and how we can contribute. I think the other thing is similar to Francis, is that I saw true leadership come about from our kaimahi. I saw the strength of our kaimahi in their own networks, and how fast they were able to get things done in their own networks, using their own networks. So I saw a lot of absolutely outstanding leadership. And it was more than just, it was working, long hours, but it was their ability to be so astute in terms of the networks that they held and being able to influence and get things done and address some of the issues. So like Francis, when Matariki, around Matariki time, and before we went into the second kind of lockdown, we did have a Matariki Awards celebration, and it was really to celebrate our kaimahi. And I think that was, if anything, when you are a manager or a CE, and you're trying to respond in something like this, the most important thing is you've got to look after your workforce so that they don't burn out. But also, I think I was always really cognizant is that the kaimahi that were turning up to work in the clinics and or in the mobile clinic units, particularly during Alert Level 4, that their own whānau had they were scared and concerned for their whānau member being out there and the possibility of being exposed as a frontline worker. So I think when you are cognizant of that, then you are very aware of ensuring that you look after your kaimahi. So there were things where, we would have them on for a couple of days, and then there would be a big stretch where they were off. So you were trying to just look after your workforce. So that was really important, and I had the luxury actually of having to have conversations with a lot of my kaimahi around that's enough, no. And whereas I've worked in a lot of tauiwi organisations where it's just 8:30 to 5 and no more, I had the opposite of having to park and put the brakes on people because they were working too long, too many hours, and they needed a break. I think also for me, I think in terms of some of the other organisations, we found we got a better response and a more collaborative response with civil defence down in Waikato than we did in Auckland. However, we changed tact in Auckland, and actually the way in which the tribe management were able to intervene and advocate opened up a lot of doors for us as providers. And in fact, with the tribe's korowai, they actually have all of the providers are quite close knit, much more than probably before. So yeah, I think that's about me. And if anyone's got any questions or anything, I can answer you.
Yeah, tēnā koe te tuakana. Ka tuka koe no te timu o tainui koe ta kāwhia moana, kāwhia kai, kāwhia tangata. Koe ra te timatanga o te waka i umai ki tērā o te moana a kāwhia. Me te kōrero, yes, within our publication, you also see a upoko, a chapter by Raukura Haura Tainui. That shares some of the things that Terina has shared with us today and others as well. And I do reflect on the kōrero of our tūpuna. Tāwhia, māku e hanga, tōku ake nei whare, I will build my own house. So that's tino rangatiratanga e mana motuhake. That we will fashion it and we will bring in those who we need to help us. And I reflect of the time of Te Puia. Now, I'm pleased that you raised it in 1918, the Spanish flu nearly devastated our iwi of Tainui. It came on a ship returning from the war with soldiers that weren't quarantined and that were let loose in Aotearoa, and they came in with a flu that then spread along the Waikato River. And it wasn't for the strength of our tūpuna Te Puia. Puia gathered all the orphans. And it's I look at all the the descendants of those orphans, and many of us work in Hauora, within the regions of counties Manukau and Waikato. So that's her legacy. And she left us a koro, mahi a ngā mahi, hei paenga mō te iwi. Do what you have to do. Do what you have to do to protect your whakapapa, to look after the wellness of your people. And that's what we heard from Terina today. And that's what all Māori do. And the lockdown word did not resonate with us, but the word rahui did, because the rahui implied you were protecting. You were protecting your whakapapa to continue. And so, yeah, we work 24/7, without having to be told, because that's our role in terms of belonging to this iwi and that iwi and that iwi, whatever that might be. And you've heard that this morning from both Francis and from Terina. I want to talk about our tribe, because we extend from the Kei o te Waka, which is counties Manukau, DHB, through the Rohe into Waikato. And that's the stretch of Raukura Haura Tainui. Two major DHBs that straddle our tribal boundaries, that take responsibility for us. So I know, because I was involved with Waikato, that Waikato DHB worked tirelessly to support what the iwi wanted, And I know there's some stories within counties Manukau that do the same thing, because they're the descendants of Te Puia's orphans.
Yeah. And,
you know, we'll probably read some of that in upoko that Terina's written. And I also want to acknowledge the tribe, where for all those over 60, they sent these huge boxes full of all sorts of things. Food, sanitizers, tissues, and that came from the tribe. And then another box arrived 2 weeks later from Kenya Portato to Whirlpool itself with a gilded letter that we could throw. So they were definitely saying, come on, our kaumātua, our priority. And so we have to look after them. We make sure that someone's visiting them, someone's caring for them, and they have enough food to get through this horrible ngāwhara that's come into our lands. So those are the joys. Yes, it was a hard time, and it still is a hard time, but those are the joys that we've seen from Tū Iwi in a remote rural surrounding, and in a largely urban, with not only ourselves as mana whenua, but ngā tāwaka and looking after and being responsible for the manaaki of ngā tāwaka within the tribal boundaries of Whakatutanu. So I thank you both. I thank you both for sharing the insights, not only for Aotearoa and other iwi and other service providers, but for our Indigenous brothers and sisters. Because I have continual contact with our Indigenous brothers and sisters, and they say we're their inspiration. So keep writing our stories. Keep writing our stories, keep writing our narratives, keep sharing them, in whatever forum that means, because we inspire them and give them what everyone needs at this time, which is hope. That there will be hope for another tomorrow. So I thank you for that, and I thank you for those who've shared with us. So the webinars are being recorded, and they will be loaded to our Te Rau Ora website for you to, if you weren't able to make it, for you, or if you did and you wanted to go back and revisit, they will be there. And we will be asking commentary from you around, was there any standout comments, and you've heard them today, the resiliency of our people, our utmost protection of our whakapapa, and in not waiting around and building our own solutions to the devastation that could have been. And make comment around who else should have been there, because we're going to keep in touch with you, because it's important too that this doesn't just stop in this form. So please do, and we'll be advertising that the webinars are up, and look forward to all the other 4 webinars coming. On the final webinar, you will see the launch of the actual chapters that these wonderful speakers this morning have shared, and last week, Tataitopera, and we'll show you how you can access those. We're always sending hard copies out to those who have contributed upoko to the chapters, and if you're friends, they might give you, with them, they might give you a copy. Otherwise, it's be on our website and access to you. So, kore he kōrero tuatu I tērā, ka watu I tēnei wāhanga I tēnā waiatano, aneira te whānau, o te whare orana e tūtahi tātou. Kia kahara. To Ngāti Prau Hauora and Te Raupura Hauru Tainu, and all our people out there working for us. Thank you for all your energies, and thank you for all your aroha and your shared kōrero and your generosity in doing that for us, Te Raupura. And we look forward to continue relationships with you, and to learn from you, and to learn from your expertise and your knowledge that you have within yourselves. Nō reira, ara, taira whiti ara tainui waka. My pleasure. Tēnā rā koutou, tēnā rā tātou.